Staying informed as a pregnant woman does not only protect you, but also protect your unborn baby. Good day, everyone, and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 11 warning signs in pregnancy that you should not ignore as a pregnant woman. The first one is severe abdominal pain. Sharp or severe abdominal pain could indicate 1. Preeclampsia, could also indicate ectopic pregnancy, and could also indicate placenta issues. So if you're having sharp abdominal pain, kindly speak with your doctor. The second warning sign you should not ignore is heavy bleeding. Yes, it is normal to have that spotting in pregnancy, but if you're having bleeding, severe bleeding in pregnancy, it could be as a result of a miscarriage or placenta issues. So it is advisable for you to contact your doctor as soon as possible. The third one I have to share with you is headache. Yes, if you're having persistent severe headache in pregnancy, it could signify high blood pressure or preeclampsia, and that is not good for you and your baby. So it's advisable for you to seek urgent medical attention. Then the fourth point is blood vision. If you're having blood vision or seeing spots, it could be a sign of preeclampsia too, and that is also not good for you. So it's advisable for you to seek urgent medical attention. Then the fifth warning sign I have to share with you is unexpected swelling. So if you notice swelling in your face, in your hands, or in your feet, it could also be a sign of preeclampsia or other complications or other things that you are not aware of. So it's also important you speak with your doctor as soon as possible. Then the sixth warning sign is fever. So if you notice you're having an increase in body temperature above 38 degrees centigrade, it's advisable you speak with your doctor because it could be a sign of infection. And when you are infected, it's not in any way good for you and your baby. So when you see the doctor, they give you some antibiotics if it's a bacterial infection, and they help you treat it adequately and properly. Don't do self-prescription at home. Then the seventh warning sign I want to share with you is decreased fetal movement. Personally, when I had a decreased fetal movement, I actually went to speak with my midwife and I was directed to the maternity assessment unit. But luckily, nothing was wrong. So if as a mother and you are pregnant and you notice decreased fetal movement from 28 weeks, it will actually signify that your baby is in fetal distress. You heard me right, fetal distress. And fetal distress is not in any way good for your baby. If not tackled on time, it can lead to stillbirth. So you know. So if you notice decreased movement, you know your baby moved in this pattern, but no longer moving the way you like, you're no longer feeling the movement. It's very important for you to contact your midwife or your healthcare practitioner as soon as possible. Then the eighth point I would like to share with you is shortness of breath. If you notice sudden or severe shortness of breath, it is very, very important that you speak with your midwife or your healthcare provider as soon as possible, because it can signify that there's an issue with your heart or there is a blood clot that needs to be taken out as soon as possible. Then the ninth point I would like to share with you is severe vomiting. So if you notice that you are vomiting constantly every time during your course of pregnancy, it's something of concern and you need to speak with your midwife or your healthcare provider as soon as possible, because severe vomiting might lead to dehydration. It can lead to dehydration and it can also lead to malnutrition, because if you are vomiting constantly, you are not having enough food. It can lead you to malnutrition, not having enough nutrients. And when you're not having enough nutrients, it's not good for you and it's also not good for your baby. Then the 10th problem I would like to share with you is painful urination. If you notice that whenever you want to go and pee, you are feeling this discomfort, this burning sensation, this pain when passing urine, it could be a sign of urinary tract infection. And if not treated, it is not good for you and also your baby. Then the 11th point I have to share with you is leaking fluid. If you notice that a fluid is coming out from your vagina as a pregnant woman, it could simply mean that your water just broke or your water is broken. So it's very advisable, if you notice that, kindly contact your doctor as soon as possible. Then the last one I want to share with you, which is the number 12, is contraction before 37 weeks. If you start having frequent, intense contraction before 37 weeks, please and please contact your midwife as soon as possible and go to the hospital, because it could be a sign of preterm labor, that you're going to go into labor and give birth to your baby. Remember that babies delivered before 37 weeks are preterm babies, so you can't really tell exactly when the baby is going to come out. So if you notice that frequent contraction coming in, it's very important for you to speak with your midwife or your healthcare provider. Thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video.